the front line and include those in healthcare, food, transportation, sanitation, and protective services sectors. We're here today to talk about our heroes in the healthcare industry. We believe that consistent with our vision of improving the lives of the communities in which we operate, it is our duty to recognize our heroes. Every day, our doctors, our nurses, our pharmacists, our orderlies, the administrative staff, and their families across the public and private healthcare sectors put themselves in harm's way to take the fight to COVID-19. Today, we're also fortunate that it's also International Nurses Day. So a special thank you to our nurses. But our heroes are our people. We are one, and we are honored to serve them as they serve us. They have sacrificed to keep our communities safe, and we are honored to be here for them. And so it is with great privilege and a distinct sense of gratitude that we announce the launch of the first of our Heroes series, the Sagicor Healthcare Heroes Group Insurance Plan. Before I ask our esteemed and distinguished panelists to present their views, I would like to invite two of the architects behind this. It's been a team effort, but certainly I would say they would have been primus inter pares. Susan Boyer and James Camacho. Susan and James are vice presidents, resident in Barbados and Trinidad. Susan, to just give a synopsis of the program, what we call the Sagicor Healthcare Heroes Group Insurance Plan. Susan.
Hi, good morning, everyone. Thank you, Ravi. It is with excitement that I sit here and join this team today to bring you what we have been working on and have accelerated in a very short week and a half time frame, recognizing that our heroes are out there sacrificing their lives for us. We have creatively developed a product or crafted a product that has it's bundled, this product is bundled, and there are 3 levels of this product, recognizing that there is an entire ecosystem out there that are working harmoniously together with different demographics. So for example, we have doctors, we have nurses, and I salute the nurses today in this Momentum Day as they celebrate. Pharmacists, dentists, orderlies, and we are saying to you, we have 3 levels of benefits, and one benefit is going to suit you. It's going to meet your needs. We are saying to you that we will cover life, accidental death, and there's a critical illness component covering 10 critical illnesses. It is our corporate social responsibility. We are here for you. And we have priced into this product a give back, a considerably reduced offer, a built-in 20% complimentary cover. And we recognize and want to say to you that there is a space out there that is not insured. There's a space out there that needs to be covered. We are reaching out to you and will work with you to bring you on board. So I will stop there now and hand over to James. Thanks, Ravi. I will hand over to James, who can add on to what I've said.
Morning, everyone. Once again, we are excited with this new product launch. I just want to add to what Susan said. Basically, we have priced the product to make it very affordable to all the health workers. The product is available not only to those in the health industry, but also their spouses, their children, and so it's really a full range product open to all those in the health industry and their family. As Ravi mentioned, this is really a first step at covering those who are in the limelight, who are in the front line of our COVID situation. And certainly there are more initiatives to come, but this will be the first whereby we are recognizing the health industry and those who put their lives at stake every day for the benefit of all of us. Okay, so I suppose Ravi will then, now add a few more words of his own before we hear from the panel of doctors.
No, I think you have done a lot. What I will ask Susan is just give a flavor of the coverages under the 3 tiers. And we can use Barbados or Trinidad or the Eastern Caribbean. It doesn't matter, they're common. And what is covered?
Right, so.
An example of what we call part of our complementary cover. So if you can just give a flavor.
Sure, happy to.
A sense of the premiums.
Happy to do that. All right, so I mentioned 3 levels, and the objective really is to ensure that we reach everyone, and it's very affordable. So if we think our first level, get at group life or life cover of 250,000, includes accidental death of another 250,000 and critical illness of 100,000. And that's level 1. For Barbados, the premiums for that level are around $90 a month. And we can say that it's probably equal to a bottle of water a day, or less than a bottle of water a day. Our level 2, similar concept with a life cover of 500,000, accidental death 500,000, critical illness 150,000, and our top tier group a life cover of $1 million, accidental death of $1 million, and critical illness of 300,000. Those premiums are around, and I'm searching for it, Ravi, sorry. James, help me there, please. The premiums are around 200 at the second tier and just over 300 on the third tier.
So 1, 2, 3 bottles of water, less than 1, 2, 3 bottles of water a day.
That's correct.
So we're trying to demonstrate affordability. At the same time, the first 20% of coverage is complimentary. So this is Sagicor's, in a way, response to our heroes. At the same time, these rates are also very affordable, very attractively priced. Again, recognizing our target of our heroes, and those, if circumstances change, once a year, you will have the ability to switch upwards. So again, that's your choice. We encourage you to cover your dependents, your spouses,
your employees.
And this is open to any of these groups, whether they're in the private or public sector. And at the same time, because Sagicor is an integrated financial services entity, you have the ability, if you so wish, to access discounts on our motor and property insurance with our general insurance company. So Kesson can also speak to that later on. So what we're trying to do here is to provide, our principle is in approaching our heroes, to blend our corporate social responsibility and blend business. First of its kind, we would say. So I'd pause there. More information will be forthcoming, and invite our esteemed panelists to give their views, and perhaps we can start from Barbados, and I'm not exercising any prejudice. So as a Trinidadian, I'm going to ask Barbados first, so I can't be any prejudice. And so if I can invite the Trevor to share his views, please.
So Trevor, you're on mute. You're on mute. Okay.
So thanks very much, Mr. Ravi Rambaran, President and CEO of Sagicor Life, other senior executives of Sagicor Life, fellow panelists and members of the media. First of all, let me say a pleasant good morning to all. And let me begin in my capacity as President of the Healthy Caribbean Coalition by thanking Sagicor, a partner of the Healthy Caribbean Coalition for the past 9 years, for extending an invitation to me to join today's press conference. Over the past several months, COVID-19 has enveloped the world, threatening and adversely impacting our people in ways seldom previously seen. But the reality is, amongst the darkness, it has made heroes of really ordinary men and women. We all know who they are, and among them are, of course, our nurses, our doctors, our orderlies, and all those associated with the medical profession who valiantly work daily on our behalf. And so we all recognize that they and their loved ones need our protection. And so it is for this reason that I am pleased that Sagicor has stepped up at this timely juncture to provide valuable insurance coverage via its Healthcare Heroes Group Insurance Plan, which assists and offers a financial shield to healthcare providers and their families as they place themselves in harm's way. The Healthy Caribbean Coalition and its more than 100 member Caribbean civil society organizations have unceasingly over the past 12 years promoted healthy living, healthy policies, and prevention and control in the fight against non-communicable diseases. Our healthcare providers are integral to this fight, providing valuable care, advice, and expertise. In short, our Caribbean response to NCDs or chronic diseases depends on them. And so this is yet another reason to support those that provide these services. The reality is that the Caribbean statistics continue to be stark, with 4 out of every 10 adults living with a chronic disease and 8 out of 10 deaths regionally resulting from a chronic disease. Sadly, it is for the most part persons living with NCDs, chronic diseases, together with the elderly that are most likely to have an adverse outcome should they contract COVID-19. The novel coronavirus not only puts people living with NCDs at risk from the pandemic itself, but this group is at further risk due to circumstances related to the pandemic. People living with chronic diseases in this COVID environment continue to require access to affordable quality healthcare and treatment, to healthy foods and essential medicines, which cannot be achieved without the assistance of, among others, healthcare providers, some of whom, in reality, are living with NCDs. More than anything, this virus has taught us that a whole of society response is needed to offer up and provide solutions for a healthier Caribbean to serve us now and going forward. I believe, as does the Healthy Caribbean Coalition, that Sagicor's Healthcare Heroes Plan is one such solution. During this pandemic, the Healthy Caribbean Coalition has been at the forefront of lobbying for those with chronic diseases. On our website, healthycaribbean.org, you will find our early recommendations via an open letter to CARICOM heads of state on NCDs in support of the Caribbean's response to the health crisis. Together with the OECS countries, we followed this with a statement on strengthening food and nutrition security in the Caribbean. And we hope that this is a legacy response to the COVID-19 pandemic. And even as I speak to you, our member organizations throughout the region are engaged in several in-country activities and initiatives. The Healthy Caribbean Coalition then will continue to advocate for and support people living with chronic diseases throughout the Caribbean during and beyond this period of heightened vulnerability. And so I want to extend appreciation again to those at Sagicor for the Healthcare Heroes Plan that seeks to protect our medical heroes and those who walk alongside them, and to say thank you for thinking of this group of persons at a time when they need it most. And so once again, on behalf of all of us at the Healthy Caribbean Coalition, I say thank you.
Thank you, Sir Trevor Hassel. I would like to call upon Dr. Didacus Jules, the Director General of the Organization of Eastern Caribbean States, to share his brief remarks.
Mr. Jules, are you joining us, and is your microphone on mute?
Sorry, yeah, I was recognizing Mr. Ravi Rambaran, the CEO of Sagicor, Sir Trevor Hassel of the Healthy Caribbean Coalition, which I note both OECS and Sagicor are members of, other distinguished panelists and executives of Sagicor. It really is an extraordinary pleasure to join this panel as Sagicor continues its very proactive responsiveness to this pandemic. As is well accepted by now, the contagion represents the single most critical threat to human existence in this new century. And COVID-19 has really compounded our vulnerabilities as small island developing states. It was someone called David Deutsch who posited that no precautions and no precautionary principle can avoid problems that we have not yet foreseen. We need a stance of problem fixing, not just problem avoidance. The emergence of COVID-19, while foreseen by some like Bill Gates, for example, and its impact were unimaginable in the minds of many public officials. The savage rapidity of its spread, the utter finality of its shutdown of the entire global community and economy, and the abrupt disruption of all dimensions of modern life were truly beyond the scope of policy planning and imaginable only in the macabre works of the imagination. In the case of COVID-19, what was required was both a stance of problem avoidance and a stance of problem fixing, except that the problem fix is still a feverish work of scientific research. At the problem avoidance level, the governments of the OECS have acted quickly and decisively. Close monitoring of the spread on the global level, measures for early detection within the OECS space, early isolation and early treatment, with an escalating compendium of restrictions and precautions as the dynamic unfolded. And I must add that in this early stage, Sagicor was one of the first private sector entities to rise to the challenge and step forward with a major contributions to the fight against containment. Although it has not been described in the public domain as yet, the governments of the Caribbean and the OECS in particular took bold and firm stances against the insistence of powerful economic actors in cruise tourism, for example, that sought to maintain business as usual in the face of threats unusual. The results of this speak for themselves. As of up to a couple of days ago, the infection curve in the OECS has been comparatively flat compared with international trends. There has been relative containment of imported cases, except for Martinique and Guadeloupe, which as part of France experienced a much greater volume of unrestricted travel between themselves and the open borders Europe. but the vast majority of COVID deaths in the OECS have occurred in these 2 member states. It is encouraging to note that as of the close of date of this report, 6 of the 11 member states of the OECS have had 0 deaths. So we are particularly pleased to welcome Sagicor's role in this. The Sagicor has been going bold and brave when others have been retreating, conservative, and contracted. The launch of the Sagicor Healthy Heroes Plan is yet again another path-breaking endeavor. And we look forward to its rollout across the region. We have always maintained that to private Caribbean corporations in particular, that as we move towards the Caribbean single market and economy and the OECS single economic space, it really would be a sad thing if that space were monopolized by foreign multinationals. And so we look forward to our own institutions, our own private sector bodies, our credit unions, helping to build that more inclusive economy. And so we particularly welcome this initiative because the health sector heroes need to be recognized, they need to be supported. There is only so much that governments can do in the effort to adequately compensate and protect them. And so we welcome this, and we are pleased to be part of this panel. Thank you.
Thank you very much, Dr. Didicus Jules. I'd like to invite Dr. Marissa Nimrod, Head of the Caribbean Association of Oncology and Hematology from Trinidad and Tobago.
Thank you very much, Mr. Rambaram. Pleasant good morning to esteemed executives from Sagicor, to my fellow panelists and members of the media. So first of all, I would like to say that I congratulate Sagicor on this initiative. Sagicor has been a stakeholder with the Caribbean Association for Oncology and Hematology, in particular looking after the relatives of persons affected with cancer. So for the past probably 4 or 5 years, we have been looking towards persons who have been considered loved ones, and obviously taking care of lives, pretty much the focus of what we do as healthcare professionals. And I would like to say that I endorse the plan and the opportunity for the frontline workers to have some sort of coverage, because in reality, we're all our brother's keepers. So as echoed in terms of the sentiments before, doctors, nurses, cleaners, everyone needs to become a team player. And the fact that this plan actually covers such is something that's very important. I think another advantage is that persons who are also working with persons on the front line, so we're looking at persons who may be administrative staff or maybe nurses, as said before, also afforded the coverage. Because from a public health perspective, infectious disease obviously spreads pretty quickly, and you may not know who's infected, but the opportunity to have coverage that will give you a better quality of life and aid in your recovery is something that's really important. So we would like to thank Sagicor for giving us frontline persons and medical professionals the opportunity to have access, not just for ourselves, but also for our loved ones. Another part of it that's also important is that persons, I think up to 65 years of age, would not necessarily need to have any medical clearance. And as spoken before, persons who actually work in the healthcare system, whether it's public or private, may also have non-communicable diseases. So diabetes, high blood pressure, and giving them the opportunity to be part of a plan where they don't have to be screened or selected is something else that makes this something that's very affordable and attractive for persons who may not previously be candidates for insurance. So from the Caribbean Association for Oncology and Hematology, and also as a medical practitioner, we'd like to say thank you for the opportunity to actually honor those who are considered healthcare heroes. And we look forward to the benefits that we know it's going to afford us to have a good quality of life and to take care of the persons who are within our purview, which would be the patients, and to make sure that everyone at the end of the day is considered a healthcare hero.
Thank you very much, Dr. Nimrod. And last but not least, Mrs. Sharon Sanchez Anderson joining us from Belize.
Good morning, everyone, and a pleasant good morning. Thank you, Mr. CEO Rambaran and your distinguished team. I thank you for this invitation to participate in this very important session that Sagicor is once again having. We are seeing that Sagicor is living up to their commitment to improve the lives of the people they serve. And as a good corporate citizen, we are seeing the proactive approach Sagicor is once more making to recognize, to honor, to protect and provide for us as frontline heroes, who during a time of uncertainty, anxiety, and even death have sacrificed ourselves and our families in order to provide the essential services so desperately needed at the time. We all saw the approach of COVID-19 on all of us. And as pharmacists, we gathered ourselves together and we did a lot of strategic planning, ensuring that we were able to provide service in this critical time. So this morning, it is indeed a pleasure to realize that even though we were not fully aware of the impact that this pandemic would have, Sagicor, the good corporate citizen that you all are known to be, have initiated this life insurance and critical illness coverage like we have never seen before, but have always desired to have as frontline workers. And the access that we as frontline healthcare workers so desperately need. And as I listen to the comments, I have to pause on the one that Dr. Nimrod just mentioned about the NCDs and the fact that the medical history is not a prerequisite to this plan. This is something of great importance for us here in Belize, because as healthcare workers, that has been a limiting factor for us getting the access that we so desperately needed. And I must applaud you all for the timeliness of this offer, because it encourages us as frontline workers to know that someone cares. And it's indeed not only words, about our families as well and our associate workers. And I must say thanks again for the affordable and inherent benefits that this plan is affording. As Mrs. Boyer mentioned, you know, the way she classified it and break it down to just a bottle of water, it shows the affordability of it for us all. And so with these benefits of this plan, it will be a benefit to all of us, right? The insidious nature of COVID-19 takes away from us the assurance we once had as a member of the healthcare team. It challenged us to give selflessly and without fear. And in Belize, we have had the benefits of now being 28 days free. We had a count of 18 in which we lost 2 of our patients. It was a scare for us, and we don't know the effects it will have. But once again, we can see Sagicor thinking, and as Ms. Boyer said, in such a short time, putting such a magnificent plan together. We are grateful. And so I thank Sagicor Group for once again meeting the needs of our people as frontline heroes. And despite the fear and uncertainty, we have taken that risk of providing for the critical at this time. So Sagicor has seen our effort, the magnitude of our effort, and has risen to that challenge. So I want to give thanks to you all. Thanks for inviting me, and may you keep up the good work as you provide for us, not only locally, but regionally. So I thank you for this opportunity, and may your plan succeed. Thank you.
Thank you very much. So now we will open the floor to our media partners. To the extent I can answer, I will. To the extent I can't, I will defer to my brighter colleagues. So, ladies and gentlemen of the media, the floor is now open.
Before the media starts, I'd like you that before you pose your question, if you could identify yourself, your country, and the media house you represent. Thank you.
Good morning.
Good morning.
Hey,
Good morning.
Sean Camerbatch from the Nation newspaper in Barbados. When will this plan be available? Secondly, what markets will it be available in? And what response do you anticipate?
Okay, so those are three questions. Basically, it's available from today. That's the first point. Secondly, it's available in all markets with the exception of Curacao, where right now we are working through some logistical issues. And thirdly, we expect a significant take-up simply because our analysis has shown that the Caribbean, and by the Caribbean, I mean whether it be the Spanish, Dutch, or English-speaking Caribbean, is significantly underinsured, significantly underpensioned. And at a time like this, you know, there are many competing demands on our various governments who are in their own way trying to assist. So what we're saying is, you know, we believe we are all in this together. And so we are also, as a private sector entity, we're saying we also have to be part of the problem. And this is just following on from our other actions in response to this virus.
Yeah, Ravi, could I just add to that by saying, sure, by saying we have also made it very simple. So through that simplicity, Dr. Nimrod mentioned it, where if you are up to age 65, there's no underwriting to come on the plan. If you're over 65, there's simple, a statement of good health. We have made it very simple for you to engage with us, making it clear though that this is a group product. So we will be encouraging nurses, orderlies, pharmacists to engage with their associations to reach out to us. Just reach out to us. We've made it very simple for you to get this coverage and very affordable. So that's what I would add to that.
Hello, my name is Nilton. I'm from Aruba, the newspaper Diario. Just want to ask James or Susan if you know anything about the premiums for Aruba for level 1, 2, and 3. Thank you.
James, you can take that one, James. James, you're on mute.
I don't have the premiums with me.
Okay, I actually just found them. Ravi, could I go ahead?
No.
Yeah, so you asked for Aruba and Curacao, level 1, $40, level 2, $75, that's Aruba, and level 3, $225, Curacao, $40, $75, likewise $225. And level 1 for Aruba, for the Dutch would be 100,000, accidental death 100,000, and critical illness 50. Level 2, 250, accidental death 250, and critical illness 75,000. And level 3, 750, accidental death 750, and critical illness 225.
Hi, Susan. Robert here. Good morning, everyone. I was just wondering if you could share the pricing in Trinidad as well. I just received a couple
Sure.
messages from
Okay, no problem.
the
I have it
associates
here. No problem.
pushing for the price.
Okay, great. That shows that they're excited. Happy to do that.
Ready to buy.
Absolutely. All right. So level 1 in Trinidad, $85. And level 1 in Trinidad is $250 of life, AD and D 250.
$80.
Right, 85. Level 2, $150, and level 3, $300. And we can make the analogy again. You can do the calculation. Less than half, the price of half a bottle of water, which we take for granted. Yes. Don, you want me to share for the EC?
Given that you're on a roll, you might as well.
Yes, you're on a roll. And
Sure.
just maybe if you could add that is pricing for 3 elements, which is life.
Yes, that's what I was saying. Life, accidental death, and critical illness, which covers.
So there are 3 elements to it. Thanks. Go ahead.
Absolutely. So for level 1, $85. Level 2, $155, and this is EC dollars, and level 3, $310.
And the
Belize,
average, sorry, Susan, tell him the amount of for level 1.
so it's the same, right? 250, 250, 100.
And Susan, could you do Belize for me as well as you're doing?
Yes, level 2, 500, 500, and 150 critical illness, and level 3, 1 million, accidental death, and 300,000. For Belize, the levels are slightly different. Level 1 is 200,000. Yes, level 1 is 200,000 group life and 200,000 accidental death and 100,000 critical illness. Level 2 for Belize is the same, and level 3 is the same. In terms of the pricing, Belize, $75, level 1, level 2, $150, and level 3, $300.
Let me just give some context here before we get the other questions. We did our analysis on looking at the distribution of incomes and the national statistics in each country. And as much as possible, tried to find coverages, certainly at level 1 and level 2, that would satisfy the majority of people who we view to be underinsured. Because in this particular group, our analysis shows that they are significantly underinsured. In fact, the tragedy and travesty of this virus is that the majority of our heroes, from whichever sector of society, are underinsured.
And Ravi, I just want to reiterate, we were going through the benefits. I just want to reiterate within those amounts, Sagicor is given a complimentary 20% within those amounts. So you are, technically speaking, for $250, you're paying for less than that. We have given you as part of our corporate social responsibility, as part of coming to the table, recognizing the sacrifice of our healthcare heroes, we are doing our part. I just want to make that clear.
Complimentary.
Every level has a complimentary cover. That's correct. Yes, that's correct.
So back to our media colleagues.
Hello. Ryan Broom from CBC News in Barbados.
I'm seeing your name coming up as Carlina Knight, so I'm a bit confused.
I'm sure if you can hear me now. This is Ryan Broom from CBC News in Barbados. Can you hear me?
Yes, now seeing you right, yes.
Okay, I'm trying to find out what's the level of, have you seen any COVID-related claims coming in as yet by Sagicor? I know a statement was made pretty early on that you would be honoring any claims coming in along those lines and giving that reassurance. Have you seen any COVID-related claims coming in from any of the territories as yet?
Sagicor overall, we have not had any material increase in our claims arising from COVID-19.
Okay, but you have received COVID-related claims already?
No. Listen to me, what I'm saying very carefully. We have not seen a material increase.
Okay.
So that is how we consider things. So once there's no material change, then we are comfortable in what we're doing. So that's why we are not trying to, at this point in time, run away or not cover what people require coverage for. So did you have any questions on our product?
Well, specifically, heard you give us some rates before. I'm not sure if I might have come in late in terms of Barbados.
All right, so let's deal with the Barbados. Let's make it easy. It's level 1 is $250,000 of coverage. Level 2 is Susan?
500,000
Barbados dollars, and level 3 is $1 million Barbados dollars. The monthly premiums for level 1, Susan?
$95, level 2, $170, and level 3, $340.
So what you're getting for that, you're first getting coverage against death, coverage against a critical illness that you may be diagnosed with subsequent to entering our plan, accidental death coverage. It provides you access to our general insurance coverage on property, on motor, with discounts of the order of 10 to 20%. And at the same time, you have the ability, depending on the circumstances, you can move from level 1 to 2 to 3. That's your choice once a year. And we're also offering complimentary coverage of 20%. So level 1 would be 20% of $50,000 complimentary cover, 20% of $500,000, $100,000 of cover, 20% of $1 million, $200,000 of complimentary cover. So this initiative, as I said, is a unique blend of corporate social responsibility and business, recognizing the groups that we are targeting.
Okay. Just for clarification, those groups again, is it only healthcare workers, or are you looking at a wider range of frontline workers?
What we're a bit like the Marvel universe, where they have different sets of heroes. So our first launch, our series 1, healthcare heroes. In my opening remarks, I mentioned that we have other heroes, whether they be in the sanitation sector, transportation sector, food industry sector. So what we're doing is we're rolling out a series, because we are creating the Sagicor universe of heroes. So these are real heroes, unlike the fictitious Marvel universe of heroes.
Okay. Okay.
Can I just add that it's not just opened to doctors, dentists, pharmacists, and nurses. It's also open to those who work for them. It's also open to their spouses, and it's also open to their children.
And orderlies. In other words, once you are within this area, because all of you are frontline.
Yep.
This is an all-inclusive approach.
Ravi, it sounds like the media are very interested in being part of our Heroes program.
And all we're asking you to do is to be actively at work, which is a key point, to be actively at work. We'll target the media next.
Okay, so any other questions?
Yes, good morning.
Hello, Mr. Wilson, how are you?
Good morning, fine, thanks. Anthony Wilson from the Trinidad Express in Port of Spain, Trinidad. Many of the doctors and other professions in health in the Caribbean are employed by the government, by the state. In that regard, to what extent is Sagicor looking to the governments of the region to undertake the coverage of the medical workers?
We are not looking to any government to undertake the coverage of any heroes, because we recognize that all of our governments are dealing with competing priorities. And they were dealing with competing priorities before the onset of COVID-19. And since the onset of COVID-19, their fiscal positions have come under pressure. So in no way are we seeking any subsidy or any type of support from our governments. What we recognize is that we can only come out of this together if both the private and public sector cooperate and we act together. So the governments are doing their part, and we in Sagicor, we have said we will do our part, and this is what we have control over, and this is what we are doing. So this in no way is an indictment on anyone. Now is a time for all of us, private and public sector, to work together. And that has been that is at the core of Sagicor's DNA, at the core of our various responses to COVID-19.
Okay, can I ask a follow-up question if possible?
Sure.
And it's a question that may not be directly related to this subject of the Heroes Health Plan. But generally, what is the financial state of Sagicor Financial Company? And I'm asking that because a large insurance company in Trinidad reported results last week, and they took a huge, they reported a loss because of the mark-to-market on their investments. So I'm wondering if there is anything similar that Sagicor has to report.
Well, what I will say to you, we are a publicly listed company, so we have to be very careful when we make pronouncements. However, in line with our obligations as a publicly listed company, we will be releasing our quarterly results soon. And so all explanations, all our results will be there. However, what I will say to provide comfort to all of our clients and prospective clients, at the end of December 2019, and we have just published our audited financial results, our total capital, both permanent capital and our debt capital, was in excess of $1.6 billion US. We are, in terms of permanent capital base, in terms of size of capital, we are larger than, or at least comparable to, any other major financial institution within the Caribbean in terms of financial strength. So there's absolutely, from our audited financial statements, we are financially strong. We meet all international benchmarks that we have set ourselves against. But as I said, more information, first of all, is within our published financial statements as at the end of December 2019. And again, in line with our reporting obligations, we'll be releasing our quarterly results. So all will be revealed there, Mr. Wilson.
Thank you.
Hi, good morning.
Hello, Kerry.
Hi, Kerry Peters, Newsday, Port of Spain, Trinidad. I just wanted to get a sense about the new product and ask whether the bundling of life and accidental death and critical illness coverage, is that something that's unique to this product, or is it something that is seen across other Sagicor products?
It's not a common feature, but we do have, as part of a suite, some products, particularly for individuals, where we would have such bundling. But this bundling for this particular group, it was structured deliberately this way.
Right.
It was structured as a group so that as much as possible, it could be affordable to this group.
Okay, thank you. The other thing is specifically about the critical illness component of this product. How is it working in conjunction with your recent announcement of telemedicine innovation How is this?
They're separate initiatives.
Right.
The telemedicine initiative is part and parcel of our medical plans. Our medical plans meaning where we provide, we reimburse you, provide coverage for doctor's visits, for surgeries, for hospital stays, for overseas emergency medical care. So our telemedicine is a part of that type of benefit structure where, given the requirement for social distancing,
yes.
We created this initiative, telemedicine. That's separate and apart from, this is another initiative.
Yeah, Ravi, I would just add to that, and thanks for that segue. I would just add to that, it's another responsibility initiative where we have said to our providers and to our clients, we are here to protect you. And protecting you means that we want you, or we're recognizing you can actually, from the comfort of your home, connect with a healthcare provider who can provide you that service so that you do not have to go out. So I would say that there is some similarity in terms of our corporate social responsibility and having stepped forward first in the market to be able to provide that coverage.
Okay, thank you.
Voice of Barbados, can you hear me well? Are you hearing me, gentlemen?
Keith, I'm hearing you, but I'm not seeing you.
Oh, my screen doesn't have a camera. I apologize for that. My question, if you could you expand a little more on the comment you made in reference to the number of persons within the medical profession that you said that were underinsured. Could you speak on that a little more? And have you done?
You're coming through intermittently. There's some background noise. I don't know if Carolyn, if you heard him better being in Barbados.
He's very faint.
No, Keith,
very
could
faint.
you,
The question to us, please.
yeah, Keith, is it possible you can try to repeat that question and maybe turn your volume up as much as possible? We didn't get the question. Keith, you are on mute.
Better? Is that any better? Is that any better?
We're hearing you, but
a little bit, yeah.
We can.
Very faint.
Okay.
Come closer to the mic. Go closer to the microphone.
Okay, I'm as close as I possibly can right now.
Okay, I'm hearing you better now. Go ahead, Keith.
I just wondered, could you expand, Mr. Ramaran, on the comment you made in reference to when you did your research, you found that a number of persons within the medical profession across the Caribbean were underinsured. Could you expand on that a little more?
First of all, I think it's a general point based on our research that the entire Caribbean is both underinsured and underpensioned. That's just that's what I would call is a global feature or an endemic feature within our societies. And being underinsured, being underpensioned applies, virtually across all strata of society, because we accept that generally insurance and pensions, they don't tend to be topics that are at the top of mind individuals as they progress through their lives. And so unfortunately, our healthcare heroes are no exception. So if we look at the range of doctors and dentists, the administrative staff within the hospitals or their various offices, what you see is a pattern of underinsurance, because underinsurance really simply means that if something unfortunate were to happen to you tomorrow, could your family, could those who depend upon you sustain the standard of living that they had when you were there? And it's amazing how many of our people fail that simple test. And that's why it's very important, even if insurance or pensions may not be top of your mind, we urge you to reach out to one of our advisors. They can at least, they've been trained and equipped to conduct a financial health check in the same way you may visit the dentist or doctor for a dental or medical checkup or the optician. What we're saying is contact one of our advisors and get a financial checkup, and you'd be surprised that will disclose the gaps. So that is, as I said, a common feature. Unfortunate, but true.
Hi, good day, everyone. Nicholas Suchman Singh here from TV6 News in Trinidad and Tobago. Quick question to Ms. Susan Boyer. You said it's a group plan. What are the least amount of persons that can actually be into the plan? Is there a minimum, and what's the maximum?
Well, the way I would answer this is that we are targeting everyone. We have not established a minimum. The expectation is that within the first 2 to 3 months, we are going to offer an open enrollment. So we are encouraging you to prompt your association, prompt your councils. You know, if you work for a pharmacy, if you work for a clinic, prompt your employer, get them signed up. We will be very flexible in terms of the time period for this open enrollment. Initially, we are saying 2 to 3 months, and then we will continue. We recognize that this is, generally speaking, you know, in our relationships with associations in the past, we recognize that this is going to take effort on both sides, and it will take work. We have made it very simple, and we are here. We will continue to work with you to ensure that we get those folk who are underinsured signed up. That is the ultimate objective.
I just want to.
I'd like just to.
There's no
I'm
minimum.
sorry.
Hi, can I just add?
Go ahead, finish, James. We have a question.
I was going to add, there's no minimum as such in that a doctor or dentist can sign up for himself. He can sign up for his workers. He can sign up for his wife, his children, but a doctor can sign up on his own. So there's no minimum, but we see the benefit of him signing up for everyone within his family and within his workspace.
Carolyn, just before you kick off, I'd just like to, I received a note here from someone following us on the media, and just tacking back to one of the questions, I think it was Kerry who raised about the uniqueness of the plan. I mean, and Ravi and Susan have talked about the underinsured and providing for their families. But the uniqueness of this plan is we also have a critical illness component, so that people have the opportunity to receive coverage for the dreaded diseases. And in fact, our plan has 10 coverages based on the levels that we have. And that would include heart attack, stroke, coronary artery bypass, cancer, multiple sclerosis, deafness, kidney failure, organ transplant, paralysis, blindness. So this is not just about the issue of death. This is also the issue of living and a living benefit. In recognition of the risks that our superheroes are facing.
Very good.
We do have a question from Dylan from Loop News, and he's asking, are premiums monthly or annually? And I would note again here that the premiums that were shared earlier are all in local currencies for the countries that they were shared for.
And they are in fact monthly, Carolyn.
Hello. If I could just ask Mr. Rambaran, perhaps Mr. Terrestrial, you talked about the culture of underinsurance as pervasive across the region. Is the answer to that new products or something else? Do insurance companies like Sagicor need to invest more in customer education? Like what is the appropriate answer? Or is it a combination of the two? newer products?
Yeah, Kerry, there's no silver bullet. First of all, I think public education, public awareness, certainly there's a role there, and we try our bit there, but clearly as an industry, we need to do better. That's one. And this is not even new products. The issue is we can structure, we can tweak existing products, we can create new products. We only look to create new products when we identify a specific group that we wish to target. We have been in existence for 180 years, so we have quite an extensive suite of products. The fundamental challenge is that many of our people simply don't have financial planning and sustainability of their income when it comes to insurance and pensions at top of mind. I'll give you a simple example. I'm not picking on on our colleagues in the banking sector. If you take Trinidad, for example, you have $9 billion TT, right? That's 9 with 9 zeros, okay, of dollars excess liquidity, not what you require, of excess liquidity in the banking system, earning close to 0%. And, but the reality is that unless money is put to work, then you will be out of work. You know, so what we are seeing is not just one of public education, but in a way, sometimes concentration of our assets in the wrong place. Okay, and the other part too, when we're looking at affordability, we looked at water. Water was used deliberately as a comparison. Water is the essence of life. What we are now saying is that, but you know, engaging in wise financial thinking is also a critical part of life. And that's why we use this analogy. For half a bottle of water of level 1 a day. So I could drink a glass of tap water and afford this coverage. I only have to do that once per day. I can continue drinking my bottled water. I mean, this is the kind of philosophical and analytical approach we have taken. So we'll do our part.
And just a quick follow-up to that. Has COVID-19 offered Sagicor an opportunity? Is it the catalyst to change these attitudes, which is, I think, what you're speaking to there, the pervasive attitudes towards money? And
I think it's a partial catalyst. Sagicor has always had a history of being innovative. But I think what COVID-19 has done is we have said as a team that we are going to accelerate innovation, because we recognize that if we don't accelerate our innovation, then our ability to help to rebuild and recover in our various countries will be delayed. We are a major financial institution. We can't just sit back and say, well, you know, our solution collectively as a people is out of our hands. We have a role to play, and this is a role we are playing.
Thank you.
I just want to add, Ravi.
Sure, Kestan, go ahead.
I think that public education is a significant component of it. I think this is about changing attitudes over time, which means that this is not going to be a short-term fix. It's going to take some time for those attitudes to change. And when we speak about underinsurance, let's be clear that this is in a total sense. So while the discussion has been largely revolving around life insurance and critical illness, we are about to enter into the hurricane season. And if we think back in the recent past, I mean, hurricanes have wreaked significant damage across our Caribbean islands. And because our populations are underinsured, governments have been asked or have had to bear a fair share of that burden in terms of rebuilding and providing assistance. So it's really the total insurance needs of our people that we speak to and we serve. which is why it's very important to emphasize that a component of this group plan does in fact afford our healthcare heroes access to that coverage, both for motor as well as property, to protect themselves and their families against the financial hardships which come with disasters. As we keep saying, don't let a natural disaster be a financial one.
Ravi, can I make an input here?
Dr. Jules?
Yeah. I'm speaking here not obviously as an insurance official, but as a regional public official. And I'm trying to wrap my head around what the meaning of and significance of this product launch for the insurance industry as a whole. I think if we face the facts, the insurance industry has generally been seen as an extractive industry. People pay insurances, it's like rolling the dice. You hope that if something happens, then you're going to get whatever is you're insured for. There has been very little public education around the importance of insurance as part of one's own financial planning. And I think given the very nature of the product that we see being launched here today, it represents a real paradigm shift that enables us to look at insurance differently in the context of COVID, because post-COVID, everything is changing. And because of what has been built into this product, I think has an opportunity by itself for Caribbean people to think afresh at the importance of insurance as part of what building resilience, not just at the national level, but at a personal level, resilience against disasters, precautions against the unknown, and doing so within a construct that clearly is part of a corporate sensitivity to the dangers faced by persons who are on the front line in the health sector. And I think it's really an opportunity for us to think afresh about the role, the function, the character of insurance in a post-COVID world.
Thank you. Members of the media?
I have a question from Carlina Knight of the Daily Observer in Antigua, and she's asking if we can go over the figures for the coverage for the EC members and also the EC premiums.
Okay, so can I ask Susan to first give the level 1 coverage and the level 1 premium, the level 2 coverage, level 2 premium, level 3 coverage, level 3 premium, slowly.
Okay, all right. All right, so in terms of the level 1 coverage, group life, 250,000, that in addition to accidental death of 250 and critical illness, and Robert went through that list with you of 100,000. The premium for that for the EC is 85 Eastern Caribbean dollars. In terms of level 2, same bundle, 500,000, accidental death 500,000, critical illness 150,000, and the premium 155 Eastern Caribbean dollars. And level 3, life 1 million, accidental death 1 million, and critical illness 300,000, and the premium is for the Eastern Caribbean 310 EC dollars.
Was that clear to Carlino?
We have a question from Keith Goddard. Carlina, if it is not clear, you can send me another message in the chat. Keith Goddard is from Barbados, and he's asking, has a calculation been done on the number of Caribbean health professionals in the region to indicate that the product has a long-term financial benefit to Sagicor? And what does that number look like?
I don't really understand the question. So if perhaps you could rephrase it in a way perhaps that will help me to understand.
So my understanding is he's asking if we've looked at the aggregate number of health professionals in the region to indicate whether this is a viable product in the long term and whether it would be financially viable in the long term for Sagicor. And do we have an idea that we can share of what that number of health professionals looks like?
So first of all, our research is proprietary, but we have looked at all of the potential healthcare heroes, doctors, dentists, orderlies, pharmacies, admin staff, dependents. Where we didn't have that information, we use international benchmarks to arrive at a number. So we used first national data for each country, and then where that national data was lacking, we supplemented it with both international data and with our own proprietary in-house data. And that was the foundation in assessing the rates, and at the same time, and the coverages. Now, given that we said that we were going to blend both business and corporate social responsibility, then that meant that the 20% of coverage that was complementary, that was basically then factored in. We then factored in the fact that our criteria would be, for you to be a hero, you have to be actively at work. I mean, because we would like our heroes to be working. And then what we said, if there were some of our heroes who are over the age of 55 and still actively at work, they would be required to sign a statement of good health. At the same time, we also said we would cover critical illnesses, the 10 that Robert mentioned, once you had contracted those after the date of entering coverage. So a lot of analysis went into this. I'd also say this, the team has been extraordinarily busy during COVID-19 because, again, it's new to us. And this was a project undertaken out of civic duty and a sense of wanting to give back. So a lot of this work was done outside of what we would call office hours. I want to make that point very clear. That is a part that is missing here.
Can I ask an additional question?
Sure, Mr. Wilson, go ahead.
Yeah. To a large extent, this new product is as a result of the COVID-19 pandemic. So the question is, Mr. Trastrell read out a list of 10 ailments under critical illness. Is coronavirus one of included among the critical illness ailments that one can get coverage for under this plan?
So if you're diagnosed with it, then we'll pay it on diagnosis. But I mean, I want to preface that right now, within Sagicor, there is no evidence of any significant increase in claims arising from COVID-19. The loss of life is unfortunate. The change in the trajectory of our lives is also unfortunate, but there's no material change. And we continue to monitor. And if there is, then we will adjust our practices to suit. But right now there is none.
But you're underscoring the point that somebody with coronavirus.
You have to be diagnosed subsequent. You have to be diagnosed subsequent.
Right. Okay. Okay. Thank you.
Ravi, Robert here again. Anthony, I'd just like to clarify that the coronavirus is not covered under the critical illness. It's not considered a critical illness. The coronavirus, as has been demonstrated, is a virus that, depending on your comorbidity factors, ultimately can lead to your death. but the virus, being diagnosed with the virus or being tested positive for the virus, does not qualify under one of the critical illnesses that I articulated. So I think I just wanted to clarify that for you, because I got the impression your question was specifically if someone was diagnosed positive, COVID positive, as I think the terminology has become known.
You have to die subsequent.
Yes, that's not going to be a critical illness that's going to be covered under the program. Thank you.
Just have a final question, if you don't mind. Has COVID-19 made the case for perhaps a more radical rethink of insurance coverage in the Caribbean, perhaps compulsory coverage as we see in places like Switzerland and other places? Do you think it has made that case for Caribbean countries?
Well, that's a bit of a leading question. I think if you ask anyone within the insurance industry, if insurance was made compulsory, what would be your views? I think there's only one answer. We would love it. But that is outside of our remit. That is a public policy issue. And we are simply, navigating our own environment. So it may have strengthened the case, but at the same time, there's a cultural element, a compulsion. Given our history, we are not a people that like to be compelled. We like to be persuaded.
Fair enough, but I think apart from public policy, it's a very human issue with a high human tool in given our particular set of vulnerabilities, natural disasters and everything else that we face, and you have this culture of underinsurance in the region. Don't you think it's for people like Sagicor, companies like Sagicor, to maybe change that conversation somewhat? And hasn't COVID-19 presented exactly the opportunity for that conversation?
It's something when we meet, we would discuss. But as I said before, right now, our governments have many, many competing priorities. They're dealing with people who have been laid off, people who simply don't know where the next meal is coming from. So I think we're sympathetic to dealing with these priorities, and we're already highly indebted countries. So yes, it would be lovely, as I said, as an industry, we would absolutely love it. But we have to be practical. We recognize that there are competing priorities, and so we will do what certainly we can. I want to clarify something, just Kerry, if you forgive me, to Mr. Wilson. Our existing Sagicor policies, Mr. Wilson, do cover COVID-19 related claims. Okay, so if you were to die or you needed treatment, medical treatment arising, we do cover those. So in no way is Sagicor trying to, disassociate itself or find ways, clever ways, not to that coverage. And I want to come back to your point, Kerry, about the significance of it. I'm going to give you a statistic. More people die every year in the Caribbean from tobacco than they die from COVID-19.
Yeah.
A sad fact. And that is something within our control.
Can I just reiterate what Ravi just said, that basically the COVID-19 is covered under the group life coverage, and for companies or individuals who may have separate health plans, it will be covered under those health plans. But that's a separate policy.
Absolutely, thanks, James. But the fact is, we do cover it if you have that policy with us. Yes.
I have a question from Keith Goddard, and he wants to clarify in terms of the pre-existing conditions, if it is the pre-existing conditions for the 10 critical illnesses, or if it is any pre-existing condition that disqualify you from the plan.
Robert, you want to take that one then, given that you succinctly explained the 10?
I think Ravi, you articulated it well earlier when you said that with regard to the critical illness, the pre-existence of those conditions are a requirement to qualify for that aspect of it. But other than that, there are no other components of the plan that require non-pre-existing issues.
So let me summarize that. You need to be first actively at work. Okay, that's the first condition. Second condition is you'd like you to pay your premiums. So I think that should be the first. Second would be actively at work. And the third is that once you contract any of those 10 illnesses subsequent to starting coverage, we will pay out a lump sum to you. So it's what Robert described as a living benefit. However, outside of those three limitations, you are good to go.
You and your dependents, employees, spouses are good to go.
Absolutely.
Guys, I have a question from our Curacao friends. I think Ravi, you mentioned earlier that at this stage it's not available in Curacao. I'm just asked to let them know that we are working with the regulatory environment in Curacao to be able to ensure that product is available in short order. And I would hope, I think we have adopted a description that we have accelerated the delivery of the plan over the last week or so. And I'm hoping that we'll be in a position to accelerate the delivery of the plan in Curacao within a similar time frame, so within another week or so. So to our friends and our heroes in Curacao, please don't think we have forgotten you. We love you and we're happy to recognize you, and we will do our best to ensure the product is available as quickly as possible.
I just want to add in terms of pre-existing conditions. Okay, as Ravi mentioned, critical illness will apply for those who pick up these diseases or illnesses after the policy has been issued. But there's no underwriting for the group life part up to age 65. But there's a small questionnaire, a statement of good health for those over 65, where they may have cases that have illnesses from before where they may not be covered because of those questions.
But generally, we expect the far majority of people to be under 65, actively at work, because our retirement ages tend to be of that. But these finer details, I think we have shared the premiums, the coverages, the rationale, the philosophy behind these coverages, and our team is available, in each market to clarify. These can be accessed through the associations, and even our own advisors having access to these various groups. So I think the key takeaway here is that this is series 1 of Sagicor Heroes, and we are simply trying to respond to what we see as a blending of corporate social responsibility and business.
Hi everyone. Just for clarity, one of the most prevalent non-communicable diseases in the Caribbean is diabetes and hypertension. So just for clarity again, persons under 65 who do have diabetes and they suffer from hypertension, would these persons be then disqualified for registering for any one of these 3 benefits listed in Sagicor?
No.
No, absolutely
Short
not.
answer is no. So let me use the example you gave there. So there are 3 benefits here. So let's take someone who's diabetic. They're fully eligible once they're actively at work for the life benefits. If they die, we'll pay the benefit. Let's say they're involved in an accident, because we do have a poor track record in road accidents, we'll pay the benefit. Let's say they're diabetic at the point at which they effect cover, but then later on, subsequent to coverage, they have cancer. We'll pay a living benefit. We'll pay a lump sum on diagnosis of cancer. So all we are saying is if you're diabetic at the point of coverage and you then you're diagnosed with it subsequently, no, you can't be diagnosed, you already have it, then we wouldn't pay that living benefit. But Robert indicated 9 other illnesses that unfortunately could befall you. And if those 9 others, you contract one of those, subsequently, we'll cover you. So the short answer is no. We are trying as much as possible to be inclusive, to be affordable, to be simple. Does that answer your question, Nicholas?
Yeah, yes, it does. Thank you so much.
You're welcome. I suspect it's lunchtime, so that's why, you know, the questions may have dwindled. So Carolyn, over to you.
So I'm just going to give the media one last chance if there are any final questions. Well, if not, ladies and gentlemen, I'd like to.
I have a question.
Okay, go ahead, Anthony.
Mr. Rambaran, I was wondering if you could give the participants in this chat an update on Sagicor's proposed acquisition of the Colonial Life Insurance Company.
I won't do that here because this is neither the time nor the place. This is about the launch of an innovative product. As I said, we will have a separate meeting. There'll be separate opportunities. One, when we present our quarterly financial reports within a couple of weeks, we'll be doing so. There'll be an opportunity then. We'll also be hosting our investors briefing, our annual general meeting. So there'll be opportunities then because in fact, I am precluded by securities laws. I don't wish to go to jail during COVID-19 from making any such pronouncements.
Okay.
Thank you very much.
I think you want to go to jail at any time.
I just wanted to recognize the heads of our various business units. So, you know, people would have seen Robert and they would have heard Don. So we have Paul and Ed, and I'll just allow them to just say some very brief words, and then we'll move back to the panel and thank them. And Carolyn, you can take it from there.
So thank you, Ravi. Good afternoon to our colleagues and the media in the Caribbean. So we're here at Sagicor. We're happy to demonstrate our commitment to our communities. And this plan is one way in which we are demonstrating that we have the interests of our frontline workers, specifically healthcare workers, that we have their interests and health and safety at heart. And we will continue to actually deliver on our promise to offer solutions to protect the many frontline workers that exist and take care of us across the Caribbean. Thank you.
Yeah, let me just say, first of all, this is Don. But I'd like to say Happy Nurses Day to all the nurses across the region. Very important day for you. And it's such a big coincidence that it's Nurses Day and we are launching this very product, which will assist all our nurses across the region. I think the other thing I'd like to say is that Sagicor again is demonstrating its leadership in the region. We have been there when we started this process in terms of our customers, in terms of our employees, and now we are developing products which are very relevant for all of our customer segments. I think this is a very important day in terms of what we're doing for our communities, and really proud to be part of Sagicor. This great experience, I must tell you, it's extremely demanding, but we're doing a lot very quickly. So please look out for the pace at which Sagicor is moving. Thank you.
Ed?
Hi, good afternoon, everyone. First of all, I also want to say Happy Nurses Day to all of the nurses. But I want to say a big thank you to all the frontline workers and the healthcare services in Barbados. We know that you have been going through a lot of tough times at this time, and we really appreciate your contributions to the wider Barbadian public and to all of us protecting our families, our friends, our associates. So thank you very much. We look forward to working with you as this policy is rolled out. And we hope many of you will join this program and protect yourselves, your families, and your children and all your associates. So look forward to doing so. But once again, a big thank you from Sagicor to all of the frontline health workers in Barbados, all from all walks of life. We depend on you, we need you, and we appreciate you very much. Thank you again.
Thank you, Ed. Carolyn.
Keston.
Yes,
Sorry. Final words from Keston. Keston, you're on mute.
Oh, sorry, I was trying to.
Okay, no problem.
Happy Nurses Day to all our nurses. It's fortuitous that we are hosting this event at this time. I think my takeaway, Carolyn, is that, and I want to pick up on what Kerry asked, because I think at this point in time, it is very important for us all in our own individual ways to preach the importance of insurance to our population. And I agree 100% that as an insurance company, we have a significant role to play in that regard in terms of public education. But I will throw to my media colleagues that the media also has a significant role to play in putting out this message that it's an important, a very integral part of our financial planning to protect ourselves, protect our families, to protect our property. And the concept of insurance is really a pooling concept. And central to that concept is one person looking out for another. So that in the context of everybody contributing to that pool, the pool takes care of those who have been impacted in one form or fashion by whether it be an illness or whether it be a natural disaster. So I am very happy to be part of this industry. I think that colleagues on the life side have come up with an exceptional product, which I believe will bring peace of mind to a significant number of our healthcare workers across the Caribbean. And as we roll out this series, we will extend that peace of mind to workers in other sectors. Peace and blessings to all, and may you all keep safe and healthy in this COVID-19 time.
Okay, Robertson and then Paul for the final words.
Hi, well, I guess in closing, just let me thank everyone for spending the morning with us. The fact of the matter is, as Keston has articulated so well, we're all in this together, and Sagicor, in its 180-year history, has continued to demonstrate our belief in our people. It's a wonderful industry to be associated with. Kerry, we have maybe 1,200 or 1,500 foot soldiers outside every single day preaching the value of insurance. We have a saying in the industry that insurance, it's not bought, it's sold, and education, as Keston and Ravi has said, and as you raised, is a key component of that. So we are committed to that exercise, and we will continue to support all of our superheroes. And I suppose, as Ravi has said, stay tuned for the next superhero to be unveiled. Have a great day, folks.
Okay, so Paul. Thank you, Robert.
So thank you, Ravi. So again, it is a joy to be able to work on behalf of our heroes. You know, just listening through this particular launch conference, I sit here and I say, we are told to actually stay at home, stay safe, so that we can save lives. And when we really think about it, there are others out there in battle, exposing themselves on a daily basis to protect us and to protect our families. And it's really, you can get kind of emotional when you really think about it, because there are others who are actually exposed on a daily basis to this virus and the effects of this virus. And I would like to say at this point in time that we want to thank all our healthcare workers, especially nurses today, as we celebrate and recognize your efforts. And I hope and pray that you will see the benefit of what we're trying to do to actually protect you and protect your families and your loved ones. And we at Sagicor will leave no stone unturned to ensure that we actually do our best to protect you and your families. Thank you.
Couldn't have said it better. Well done. Well said. So Carolyn, over to you.
Well, ladies and gentlemen, we thank you so much for joining us today as we announce this important news for our healthcare heroes who have been bravely on the front line and standing between us and certain doom. I know that sounds quite dramatic. However, what you do every day is quite dramatic. So we wish again to thank our guest panelists, Sir Trevor Hassel, the president of the Healthy Caribbean Coalition, Dr. Didicus Jules, Director General of the OECS, Dr. Marissa Nimrod, head of the Caribbean Association of Oncology and Hematology of Trinidad and Tobago, Mrs. Sanchez Anderson, the former chief pharmacist in the Ministry of Health, a practicing pharmacist in Belize, and also those joining from member associations, Dr. Jam Tams, the chairman of the Advent Hospital in Curacao, Mrs. Gina Maduro, president of the Aruba Association of Employees and Healthcare Institutions, and she also works in the emergency room at the Dr. Horatio Aduber Hospital in Aruba. Thank you all for joining us and helping us spread the good news of this information on our Healthcare Heroes Plan. I implore each and every one of our clients, team members, family and friends to show their gratitude to this group of amazing heroes and to adhere to all safety measures, regulations, and restrictions as they protect us and we protect them. We are all in this together, and that requires a joint effort from all of us. To the media, thank you for spreading this critical information necessary to win this fight against COVID-19. Your role will never be understated. And to our followers on social media, online viewers, and those streaming live, thank you for your continued support. I'm Carolyn Shepherd, and on behalf of all of us at Sagicor, stay safe.
It's okay, guys, you can hang up now.